this technology that's being developed by Australian companies is clearly peculiar to them. I mean, are there companies overseas that are doing similar things or better things? I mean, why should an investor look at these Australian companies ahead of American companies, for instance?
Well, these Australian companies, like all companies, have intellectual property protection over their discoveries. So there are different ways of doing this approach. You know, different cancers lend themselves to slightly different ways of detection, each of which can be patented and owned by different companies. So investors should really look to see what the patent covers, where the patent's been applied for or registered, and the market opportunity for that technology to be applied. I mean, clearly where you have a large market opportunity like non-small cell lung cancer, there's a lot of competition. Where there's more obscure cancers or rare cancers, then there's fewer companies working in that space. So, you know, but it's also a smaller market. So in one sense, the technology is what drives the value, but there's also likely to be competition. And the first to market is not necessarily the best to market. You know, being first to market establishes, I guess, a new approach to liquid biopsy detection, but there's likely to be improvements made once that door is open. So Australia has many advantages in terms of its clinical trials and its ability to move quickly. America has advantages in that there's lots of investment money for the right approach. The fundamentals of what to look for in an investment in biotechnology are still the same, and diagnostic companies are just as investable as therapeutic companies, and they have the same risks, really. In fact, fewer risks, because a diagnostic company actually has less risk, because it's a lot easier to get a proof of concept and a clinical trial done in diagnostic technology than in a therapeutic. So investors should obviously, you know, be very well read about the about the company and the technology. Ensure that they do their homework.
In a nutshell, Peter, what would you recommend that investors look for? Where should they go to look at the companies that in the diagnostic space that could be interesting?
Well, AusBiotech has a list of companies in the medtech and diagnostic space. They're listed there, and if the investors want to think about investing in diagnostics for cancer, it's a very exciting area where new technologies and new findings are certainly coming rapidly. There's real opportunity, I believe, to get a significant return on investment in a relatively short time, much shorter time than in most therapeutics. So, but of course, you know, like everything, you need to make sure that the technology and the management and the business development approach is sound.
Oh, marvellous advice, Peter. Thank you very much.
Thanks, Fiona. It's been a pleasure.